Yes.
Recording in progress.
Yes. Good morning, everyone. Good morning. In our day-to-day lives, we often affected by various kinds of ailments, both general and complex, and hence we seek the help of the doctors. In the city like Mumbai, finding a doctor is easy, but what about Tier 3 city? The ratio of doctors is not very favorable to the patients. So, as a general citizen, it is very difficult to cope with the advanced medical treatments and procedures. Here is where DigiSwasthya Foundation comes in. Their aim is to make healthcare services affordable, accessible to all. Today, we are joined with three distinguished guests from DigiSwasthya Foundation. So, on behalf of Humera College of Education, Management, I welcome you all. Dr. Pallavi Roy, she is the co-founder of this foundation. Welcome, Dr. Ma'am. Mrs. Preeti Khurana, Mrs. Bindu Mehta are also social workers and are associated with the same cause. Welcome, Preeti Ma'am. Welcome, Bindu Ma'am. Without further delay, let's begin with this session. Over to you, ma'am.
Yes, good morning, everyone. So before I begin, I just wanted to ask if you would be more comfortable in English or in Hindi.
Ma'am, in both the languages, they are quite comfortable.
Both the languages, okay, all right.
Yes.
Fine. So in any case, I mean, if there is something that you don't understand, feel free to stop me in between and I will clarify whatever doubts you have. So I'll start with what DigiSwasthya is and what we do. So DigiSwasthya Foundation was started by a cancer survivor, Mr. Sandeep Kumar, who did not find the right treatment at the right time. It took him about 6 months to get the right diagnosis. Now, as you all know, that cancer is a serious disease and there are so many people who suffer from it, right? In a country like India, like ma'am rightly said, that doctors are many, but it is very difficult to find the right diagnosis when you are living in an area which is rural or when you are a part of a marginalized community. So these people, because they aren't able to seek the help that they need at the right time, they often reach the stage where the disease progresses. It progresses to a level from where it is difficult to come back. That's why DigiSwasthya Foundation was started, and we are trying to work with telemedicine centers. How many of you have heard of telemedicine center or telemedicine? Can I just have either a show of hands or you can type in the chat box as well? आप में से कितने लोगों ने telemedicine के बारे में सुना है?
Ma'am, during pandemic, we just seek help from the doctors through the Google Meets or this kind of a session. Otherwise, earlier I was not aware of that.
Right, ma'am. Right. So that is one good thing that the pandemic did for us. हाँ, okay. Chat में किसी ने लिखा है? No. Okay. All right. Anybody else? We have 65 people on call. कोई और शेयर करना चाहता है कि उन्होंने कभी टेलीमेडिसिन के बारे में सुना हो? क्या सुना है उन्होंने? आप लोग चाहते हैं तो अनम्यूट करके बता सकते हैं. Please feel free to unmute yourselves as well. No. Okay. Okay. All right. So telemedicine के बारे में आपने नहीं सुना है, but how many of you have heard about video calling, or how many of you video call on a regular basis? Video calling? You do. Okay, great. Does anybody else has? Okay, people are raising their hands. That's great. Okay, all right. So people know about what video calling is, but they don't know what telemedicine is. Now, what telemedicine does is that it enables you to video call with your doctor. So has anybody done that? Has anybody video called with the doctor and sought consultation online? Okay.
During pandemic, ma'am, we did once for my in-laws. I did it, but yeah, during pandemic I did it.
You did. Okay, ma'am.
Otherwise, before that, I was not aware of that.
Right.
These kind of services basically exist. I was not aware.
Right, ma'am. So many of us were not aware of it. And because of the pandemic, we realized that we can stay in touch with people using video calling and other features of that sort. Telemedicine enables us to connect with our healthcare professionals in a similar way, right? So just a minute, I will, yeah. So what we've done is that we have set up physical centers. We will give you a tour of our center that we have here in Mumbai. Why did we create the center? Because there was a lack of doctors. During the pandemic, we saw that the healthcare system was burdened. There weren't enough doctors to treat the patients. Lack of facilities. We realized that we don't have enough facilities. When the pandemic struck, we realized, okay, oxygen concentrator, oxymeters, oxygen cylinders, medicines, there is a dearth of these resources in India. Now, however, India is one of the largest manufacturers of PPE kits and things like that. But during that time, when we needed the facilities, we did not have that. You can imagine that how bad it is in the rural areas. We sitting in urban areas in cities like Mumbai, we still have some resources. If you fall sick, there will be at least 4 or 5 clinics around you where you can go and have a consultation with a doctor. But think about a village where there is probably just one doctor, and that one doctor caters to the entire village. And we don't know about the credentials, right? That is where the inferior treatment part comes in. Inferior quality of treatment. So these doctors are not really doctors. They are unregistered medical practitioners. They are quacks. Or how many of you have heard of these people, these healthcare professionals who don't have a degree, but they claim to be doctors? Have any of you met such people? Okay, great. Yes, you can raise your hands. Okay, all right.
Ma'am, in Wadala area, you can find this practice.
Right, right. Okay, yes, you heard a lot about it. Exactly. And this is a growing problem. Because what happens when you go to such doctors is that they will provide you with inferior quality of treatment. They don't know exactly what they're doing, right? Because they haven't studied medicine. They are just doing what they know with their limited knowledge. If it works, it works. If it doesn't, then may God help you, right? So we cannot depend on such people. And this is prevalent in the rural areas, in marginalized communities where awareness is less. You have heard about it, you are aware about it. So that's good, that's great that people in your college know and they are privileged enough to understand and differentiate between a registered medical practitioner and somebody who is unregistered. So you would know, nahi, mujhe nahi jana unregistered ke paas. I don't want to go to a quack, I want to go to a proper doctor, right? Now, another issue that comes up is, let's say the villagers are aware that, okay, we'll go to a registered practitioner, we'll go to a doctor who knows medicine, who studied medicine. But where do they find these doctors? They're often far away. They have to travel at least 100 kilometers, right? From the villages to the nearby city. And just the traveling, the stay, accommodation, travel, food, all of that, it is an expense. It is an added burden. So how many of you have had to wait in long queues at the hospital or clinics to wait for a doctor, to wait for an appointment? Okay, great. You've done that. Okay. So telemedicine is solving all of these issues, right? With telemedicine, we have at DigiSwasthya, we have a panel of doctors which has 100 plus healthcare professionals from all across India. And these doctors belong to some of the hospitals that even you might have heard of. Hospitals in Mumbai like Tata Memorial, JJ, Vadia, Sion Hospital, KEM. So we have doctors on board from these places. Now, if you were to go for a consultation with these doctors, let's say at the hospital or the clinic, you would have to pay a lot, right? You would have to pay a hefty fee. What is the highest fee that you've paid for a consultation? कोई मुझे बता सकता है कि आपने सबसे ज्यादा एक कंसल्टेशन के लिए कितना दिया होगा फीस डॉक्टर को? 2500. Okay, all right. Yes, 2000 plus. That's absolutely right, because that is the nominal, that is the rate, that is how much doctors charge, right, at these hospitals. And it is valid. Don't think that the doctors don't deserve this fee. They very much do, because they're working really hard. But people cannot afford this. Not everyone can afford this kind of a fee. So what we are doing at DigiSwasthya is that we're making healthcare more affordable. These doctors who charge, let's say 1,500 or 2,000 at their clinics, at their hospitals, they charge 100 to 200 at our centers. Why? Because even they want to provide social service, and they've tied up with us so that they can help these communities which don't have access to healthcare. So you can see over here that the mission of DigiSwasthya is to make healthcare services affordable and accessible for rural communities across India by leveraging technology. What is this technology that we use? That is telemedicine, right? And our aim is to provide early diagnosis and prevention. In these villages, 4,500, okay, somebody is still answering that they've paid 4,500 to a doctor, right? So we're trying to make healthcare more affordable for everyone. For people who, in Mumbai, we started this with a vision. Preeti ma'am and Bindu ma'am, they started it with a vision that we want to help the migrant workers. We want to help the marginalized communities who reside in Mumbai. People who live in the cities but are still not able to avail these services. So this is our board of directors. And these are our telemedicine centers. You can see that the first one was started in Uttar Pradesh, in Sant Kabir Nagar. That is the home of the founder, Mr. Sandeep Kumar. Then the second one, we started it in Bihar. Third one is in Ahmedabad, Gujarat, where we serve the nearby slum areas. Fourth one is in the Tekawadi district of Pune. And the fifth one is in Oshiwara, Andheri, which is where I am right now. So how close is this center from your college? Can somebody tell me? How close is Oshiwara, Adarsh Nagar? Five minutes. Okay. So can I expect you guys to visit the center today? It is nearby, right? Okay. So I would want you all to come here and visit the center physically so that you can 10 minutes. Okay, you would love to. That's great. So I'm expecting some of the students to be here today, and we have our team over here who can guide you. They can show you what the center is like. You can also bring in other people who might be interested in availing these kind of services. So what are these services that we provide? We have telemedicine centers in rural India as well as in urban India now. We have awareness campaigns. So, me telling you about telemedicine, telling you about these centers, that is a type of an awareness campaign. We have electronic medical records. A lot of times people lose their medical records. They don't know about the medical history. They don't know that the drugs they're on, the kind of surgeries that they've had, right? So for that, we are making these records electronic. And I would just take a few minutes, maybe at the end of my presentation, to show you what the center is like, right? So cancer care is something that we focus on, and we also have referral network with the hospitals. Like I told you before, that we have tie-ups with all of these hospitals. I mentioned some of them which are in Mumbai. Any membership for the center? No, there is no membership for the center, but you can come in and you can avail a consultation whenever you want. There is a registration fee. There is a nominal consultation charge. So maybe, once you come to the center, we can explain more to you and we can tell you how exactly it works. Before that, I would like to walk you through the process of how the teleconsultation takes place, right? Once the center, the patient walks into the center, we have a patient navigator who is a team member, and they are trained to measure your vital signs. What are these vital signs? Like your glucose levels, height, weight, blood pressure, temperature, all of that. And then they convey these metrics to the doctor. This is done through our telemedicine software. And in the process, we are also generating an electronic medical record. So all of this is stored in a secure cloud. This way, the data is never lost. We always have your data. You can access it whenever you want, wherever you are in the world. We can send it to you because it is digital. ऐसा नहीं होगा कि आपने फाइल फोल्डर बनाया है हॉस्पिटल का, आप सिक हो गया या हॉस्पिटल सिक हो गया. ऐसा नहीं होगा कभी भी, क्योंकि हमारा सब कुछ digitally stored है, right? And it is absolutely safe. We follow all the privacy regulations too. Now, after you have connected with the doctor over a video call, जैसे हम लोग बात कर रहे हैं. So similarly, a doctor and a patient can connect like this. We can have the consultation. After the consultation is over, the patient is given a prescription with the medicines that they need to have, or let's say the doctor advises you to go for a blood work. So then after that, we guide you to the pharmacy or a lab. Again, we have tie-ups with pharmacies and labs. So they provide about 40 to 50% discount to the patients of DigiSwasthya, because we know that just the consultation is not the last step. We want to help beyond that. So that's why we have these tie-ups, so that healthcare can be accessible all across the supply chain. And it does not stop here after the consultation. Now, sometimes what happens is that patients come into our center and they are diagnosed with something that is more serious. That is something that primary healthcare cannot address. They need tertiary intervention. आपको हॉस्पिटल जाने की जरूरत पड़ सकती है उसके लिए, या किसी और क्लिनिक या स्पेशलिस्ट के पास जाने की जरूरत पड़ सकती है. So even for that, we connect you to the doctors, we connect you to the hospitals. Do we have free blood test facilities? No, we do not have free blood test facilities. You can come to our center to get your glucose levels checked. However, for any blood reports that you need, let's say complete blood count chahiye aapko, or you want to get some hormonal assay done, all of that can be done with the partner labs that we have, the pathological labs that we have tied up with. You can go there and it is nominal. I will tell you, it's about 1,200 or so, I think. And we're going to bring the price further down. So that is something that you can explore once you are here at the center. So we also connect you to these hospitals. Yes, did somebody want to say something? If you wish to say something, you can unmute yourself, or you can put it on the chat box and we can, I can address it later. Okay, all right, I'll move on. So these hospitals, if let's say somebody is diagnosed with cancer, we help the patient connect to the social work department of the hospital, and we help them through all the documentation process. What are the different cards or schemes that you require? Let's say like Ayushman Bharat or the PM fund, CM fund, how to apply for those. And we can also help in fundraising. Now, I'm not saying that we will sponsor the treatment. We are, that is not something that we take up as an organization, but we can help you. We can refer you to organizations that aid with that. So there are a lot of non-profit organizations working across, the different verticals that are there. And we all come together. It's a collaborative process, and we try to help the patients in the best way possible. Now, these are some of the photos from our Sant Kabir Nagar Center. You can see over here the teleconsultation is going on. And even here at our Andheri Center, we have a similar screen or laptop. There is a separate consultation room with a door so that privacy is maintained, confidentiality is maintained. काफी लोगों को लगता है कि उनका जो मतलब इंफॉर्मेशन जो प्रोवाइड कर रहे हैं डॉक्टर को वो सेफ रहना चाहिए, कॉन्फिडेंशियल रहना चाहिए. तो हम आपका कंसेंट लेते हैं उसके लिए, एंड वी एंश्योर दैट इट स्टेज बिटवीन यू एंड द डॉक्टर एंड नोबडी एल्स हैज एक्सेस टू दैट. So far, we've had about 95 plus awareness campaigns. We've served 4,000 plus patients. We also helped during COVID. These are some of the cancer cases that came up at our center. Like I mentioned, we have 100 plus healthcare professionals on board and 5 centers all across India. There are 18 labs that we have tied up with, 10 pharmacies and 9 specialty hospitals. And these numbers keep increasing. We also worked on a comparative analysis to see how much time and money the patient saves if they travel to a local DigiSwasthya center versus if they have to travel to the nearby city to avail treatment. Now, all of you are in Mumbai, so you have a lot of centers around you, but this is more for people who are living in the villages. So if you know someone who is in the village and you would like to start a similar center in your district, in your village, you can reach out to us. These are some case studies that we have. We have a lot of success stories. You can also visit our website to read more about that. Again, these are some of the awareness campaigns that we worked on. These are door-to-door campaigns. You can see our team members going from door-to-door, village to village. And we also conduct webinars like we are conducting this one. These are some of the awards and achievements. Some media mentions. You can see that there has been coverage by the newspapers, online media bodies, and even FM radio stations. These are some of the doctors who are there on our board, and you can see that they belong to the renowned hospitals. Now, how can you help? We often ask our beneficiaries to pay for the treatment, whatever consultation they're availing. Like I mentioned, that the fee is quite nominal. It's 150 to 200 rupees per consultation. In some cases, it also comes down to 30 rupees or 50 rupees when we conduct camps. However, if somebody is not in a position to pay, we sponsor that consultation for them, and we provide pro bono consultations. So in return, we also ask people to support us, whether they can sponsor these consultations for the patients, and they can also sponsor medical devices, laptops, tablets, screens. These are some digital devices that we need at the center. So I think that's about it. Now I would request Mandakini to show us a tour of the center, and I'm going to stop sharing my screen. If you want, you can take a screenshot of this, and I can also circulate this information later with you. In the meantime, if anybody has any questions or comments, you can put it in the chat box. Yes, hi Mandakini.
हेलो मैम, मैं भी कैंप सेंटर का दिखाती हूँ बाहर से ना। ये बाहर से है, रूम नंबर 628। फिर हम एंटर करते हैं अंदर। ये रिसेप्शन एरिया है। यहाँ पे पेशेंट आके बात करते हैं, बैठते हैं और पेशेंट नेविगेटर से बात करते हैं, सब चीज़ें जान के लेते हैं, सब पूरा प्रोसेस समझते हैं। और फिर यहाँ पे उनका वाइटल भी टेस्ट होता है। वाइटल होने के बाद में ये हमारे डॉक्टर के बोर्ड है जहाँ पे हमने लगा के रखा है पूरा, और फिर वो अंदर जाते हैं और इधर डॉक्टर से कंसल्टेशन होता है उनका। यहाँ पे डॉक्टर से बात होती है एंड ये डोर क्लोज कर दिया जाता है ताकि अंदर से बाहर आवाज ना जाए और अच्छे से लोग बात करते हैं। और फिर यहाँ पे बात होने के बाद में फिर वापस से उनको उनका बाहर जाके बैठते हैं इधर वेटिंग एरिया में। फिर उन्हें उनका प्रिस्क्रिप्शन दे दिया जाता है एंड उनको समझाया जाता है पूरा प्रोसेस अच्छे से। फिर वो वापस से अपने घर जाते हैं। हम लोग उनको पैथोलॉजी पे अगर जरूरत रहती है तो भेजते हैं, और या फिर मेडिसिन उनको लेना रहता है तो मेडिसिन के लिए भी हमारा पैथोलॉजी से लैब और सॉरी हमने टाई अप्स करके रखा है, जैसे भी मैम ने बताया। थैंक यू।
Thank you, Mandakini. So this was a virtual tour of our center, but since you all are just 5-10 minutes away, please come by the center. Our staff members are here. You met one of them, Ms. Mandakini. There are other team members as well, and they will take their time to explain everything to you. आपको कोई भी question है, आप कुछ भी पूछना चाहते हैं, आप please आइए, अपने family members, friends सबको लेकर आइए। अगर आपको consultation नहीं भी कराना है, सिर्फ enquiry के लिए आना चाहते हैं, तो you are most welcome. No, so
thank you very much. Thank you very much.
अंजलि, हम जेनेरिक हम ब्रांड्स हम मेडिसिन नहीं डिस्पेंस करते हैं। At the telemedicine center, we are only providing consultations. We are not allowed to sell medicines. So that's why we have a tie-up with the pharmacies. In fact, just near our center, there is a pharmacy. So you don't even have to travel very far. आपको यहीं से हम बता देंगे, हमारे टीम मेंबर्स गाइड कर देंगे कि where the pharmacy is. You can go to them, tell them you're coming from DigiSwasthya Foundation, and they will give you the drugs that you need.
Tell me, Pallavi, you are making some kind of a card, those who get associated with your organization, like some card, how come a pharmacist come to know that we are coming? Anybody can come and say that they are associated with that. So it means you people must be making some kind of a card or something like that.
So ma'am, we have a DigiSwasthya prescription. Only once you provide the prescription.
Okay, okay. After doing the consultation only, they will provide us with the medicines. They will give us the, okay, yes. Fine. I thought anybody who has not taken the consultation, but they want a discount on the medicines, in that also you people are helping.
Okay. मैं रिक्वेस्ट करूंगी कि जल्दी से दिव्यांशु अगर बताना चाहते हैं about the lab, वो भी हमारे टीम मेंबर है, वो आपको मिलेंगे यहाँ पे सेंटर में। he would like to share
Fine.
something about the labs and
Good morning, everyone. एक मिनट मैम, एक मिनट गुड मॉर्निंग। जैसे कि मैंने बताया, तो हमारे लैब ऐसे मतलब कई जगह पैथोलॉजिस्ट है, उसके बाद फार्मासिस्ट है, तो हमारे नियम में ही ज्यादा दूरी पे है, मतलब बाजू में फार्मेसी और वेलनेस केमिस्ट कहते हैं सिग्नल के पास। सो वहाँ पे हमारा टाइप है जहाँ पे वो हमें 15% डिस्काउंट देते हैं अंडर 500, जो 500 के अंदर प्रिस्क्रिप्शन मेडिसिन आते हैं। इवन 500 के अब जो मेडिसिन रहते हैं वो आपको 20% का डिस्काउंट देते हैं। एंड देन और सर जैसे हम हमारी बातें चल रही थी, हम हो सके अपने पेशेंट को कम से कम दाम में उनकी ट्रीटमेंट अच्छे से हो सके, कम से कम दाम में उनके चेकअप अच्छे से हो सके। देन हमने और भी सारे पैथोलॉजिस्ट से बात की है। एक पैथोलॉजिस्ट ने ये बोला कि हमें 45% प्लस अगर आप पेशेंट हम यहाँ पे पेशेंट को दे रहे हैं, और इससे भी ज्यादा काम कर रहे हैं कि इजी हो सके, ज्यादा पेशेंट को भागना ना पड़ सके। एंड देन प्रिस्क्रिप्शन जो हम देते हैं प्रोवाइड करते हैं, वहाँ पे हमारा DigiSwasthya का स्टैम्प भी लगा के देते हैं ताकि पता चले कि हाँ यहाँ से ये गया हुआ है, और स्टैम्प भी रहता है कि ताकि मतलब कि फेक ना लगे, गलत ना लगे, और पेशेंट को अच्छे से मेडिसिन प्रोवाइड किया जा सके। थैंक यू।
Thank you, Divyanshu. I think there was some, echo, I think. So I'll just explain what Divyanshu said, that we provide the prescriptions with the stamp, with the proper DigiSwasthya seal and the letterhead. And we have tie-ups with the nearby labs and hospitals. Again, whatever Divyanshu said, he can always repeat himself once you are here at the center. So you can come in and we can take some time to talk about how these tie-ups are beneficial for the patients that come to DigiSwasthya.
Yes, thank you, Pallavi. Thank you, Dr. Pallavi. I am very happy that you people are associated with such a noble cause. Keep up the good work, ma'am. From HK College of Education, I thank you for that. And Vasha ma'am, please take up. Who is giving the vote of thanks to them?
Yes, ma'am.
Yeah. One minute, ma'am. 1 minute.
Is it audible?
Yes, Vasha ma'am, you are audible.
Oh, okay, ma'am. Hello, am I audible?
Yes, Afshan.
Out of the door. Thank you, DigiSwasthya Foundation, for such a great initiative for healthcare affordability and accessibility. Thank you, Dr. Pallavi Roy, for introducing us with telemedicine and your centers at a number of places. We'll definitely grab a chance of a checkup and consultation at a nearest center possible. Thank you, Mandakini ma'am and Divyanshu sir, for a quick tour of your center and update. Thank you so much. I would also like to thank our principal ma'am, Dr. Nilu Sharma, for organizing this. It was really helpful and informative. Thank you so much.
Thank you all. Thank you very much, Dr. Ma'am. Thank you, Preeti ma'am, and thank you, Mehta
Thank you, Nilujit. Thank you so much.
Thank you very much.
Bye-bye.
Thank you. Bye-bye.
I have left some links in the chat box. I'll also share them with Preeti ma'am so that they can, be circulated among all the students of the college.
Thank you. Okay, ma'am. Definitely.
Thank you so much, everyone. Thank you, ma'am.
Thank you. Bye-bye. Bye-bye. Thank you.
Yeah, that link is, the link is only for the information part. You all can just copy paste if you all want. Yeah.
Shall we proceed with the orientation of faculty?